Garrett, thank you. New at 5 o'clock, Indiana is red-free. The latest metrics map from the state health department shows a dramatic shift in the spread of COVID-19 compared to just a month ago. 22 counties are in blue, the lowest level. The majority is the next level up. That's the yellow that you see here on the map, and only 5 counties are in orange. The drop in spread is showing also in hospitalizations. 41 fewer Hoosiers are in the hospital tonight with the virus compared to yesterday. It's the lowest number since July 27th, when 781 Hoosiers were hospitalized.
Thanks to the progress we made in the past year, COVID-19 no longer need control our lives.
President Biden vowing to move beyond the emergency state of the COVID-19 pandemic, saying the U.S. is in a new moment as cases drop and masks come off. Now the president's plan to emerge from the virus, announced during last night's State of the Union, is out. We want to bring in Wish TV medical expert and former Surgeon General Dr. Jerome Adams now. Doc, always good to see you. Let's start by talking about that Biden administration's new COVID-19 initiative. It was released today, as you know. The Test to Treat plan also includes a one-stop location to get a free test and free treatment pills. Now, you tweeted last night that there needs to be more details on how the program will be implemented. Does the plan that was released today give those details?
Well, it gives many of those details. We need to make sure the locations are going to be in places where people who are most likely to be harmed by COVID can access them. So I know that one of those locations is likely to be one of the 3 pharmacies that is within 2 miles of where I live. But many people don't have that luxury. We want to make sure everyone has an equitable opportunity to get tested and get treated.
President Biden, as you very well know, also noted the U.S. must be prepared for new variants. We've talked about it here on the show before, and also mentioned variant-specific versions of vaccines and treatments. In your opinion, do we need them?
We need to continue to innovate because this virus is going to continue to innovate and mutate. But we also need to rely heavily on what we already know works. And that's masking when you are high risk or when you're in a situation where you have increased spread. And you laid out that still a significant part of Indiana is in the orange or in the middle risk, the yellow categories. That's testing and treatment. And you heard the Biden administration lay out that plan. If you test positive, if you have symptoms, make sure you ask about treatment. But that's also filled vaccinations and boosters. And I would have liked to have seen the Biden administration talk more about what they're going to do to engage people, not to shame them, but to engage people and help them understand the importance of getting vaccinated and getting your booster.
So it was pretty obvious to everyone watching last night that the masks came off the State of the Union, but there were a handful of members seen masking up, and we saw President Biden going up to crowds, shaking hands, even hugging. In your opinion, does this send the wrong message?
Well, I absolutely think that it sent the wrong message to America. I'm not big on virtue signaling. I want people to do it for a reason. Well, they actually had a reason. They had 4 positive cases in Congress prior to the State of the Union. And they also have many vulnerable people, elderly people, who were in that tight and confined setting. That's an environment where people should have been masking, in my opinion. And I want people in the public to know that there are situations where I don't mask because I know I'm vaccinated, because I know other people are low risk, vaccinated and boosted, mind you. And I often test before I'll go around other people. But there are also situations where I do mask. And we want people to be able to make those choices intelligently and to their best benefit. And I think that really they should have set a better example last night, given what they're asking America to do.
The administration also said today that it's evaluating the mask mandates on public transportation, including airplanes. Do you think that we're at a place where we can drop that mandate?
I actually think we are close to getting there. Again, we want to see a little bit more of the country in that green category instead of in the yellow and in the orange. But it's frustrating to people, and we know that it is just one of the many tools we have available. I would say to the people out there, it's coming soon, but do your part, because once that goes away, that's one less public protection that you have. And so you need to rely on personal protection. You can still choose to mask, and I'll still probably choose to mask on flights when I'm out there, but you can also get vaccinated and get boosted to protect yourself. Make a personal choice, even if it's not a mandate, to do the thing that will put you in the best possible position to stay healthy.
I have about a minute left. We've talked several times here throughout the year. When, in your opinion, are we going to get to this being an endemic instead of a pandemic?
Well, we're not going to get to an endemic phase until we see hospitalizations and deaths go down. And we're still having a high number of deaths. We also know that we're likely to see more surges. So we need to be prepared for those surges. We aren't going to scientifically get to an endemic phase for a while, but we can get to a place where we can live with the virus if we use masking, testing, treatment, and vaccines, including boosters. We've got the tools. I want people to choose to use those tools so that we don't get into this debate about mandates and the government trying to make you do something.
Wish TV medical expert and former Surgeon General, Dr. Jerome Adams, thank you for joining us. As always, sir, we'll talk soon.
Always a pleasure, and hopefully we get MLB going, Phil. I know you and I are there on that.
Oh, yeah. Fingers crossed, doctor. Good to see you.